Your uterus is still tucked really low, okay? It's not your freaking baby. Don't let nobody tell you any different. We'll get serious. No, we won't. Because even if you have a birth plan, a lot of the time they're not going to read it. I did that. It was the coolest experience of my life. Like,
You come in, oh no, you're 2. I'm like, go get him. Like, I'm not listening. I'm not going back.
welcome to Waddling After Dark. My name is Christian.
And I'm Alicia. Tonight, we're in the low, deep darks of Waddling After Dark, where it's late, your body's acting suspicious, and your brain has just logged out. Because same. If you're hopped up on funnel fries, if pregnancy has decided to unlock a bonus feature you did not consent to, hello.
Hello from the other side. We're chronically online. Leave us alone. Anyways, if you're laying in bed wondering, is this normal? Am I okay? Why is my body doing that? Welcome. You're in the right place.
Nothing you're asking is dumb. Pregnancy is just feral, so let's do it.
Let's get it. Number 1. One day I look pregnant. The next day, my stomach is flat. Why? Well, first of all, I hate you because my stomach is never flat. It's because your belly is a liar. Early pregnancy bumps are mostly bloat, gas, constipation, hormones, vibes, all the things. Your uterus is still tucked low behind your pelvic bone. Your uterus is still tucked really low, okay? It's not your freaking baby. Okay, it counts though. It counts as a baby bump. Okay, don't let nobody tell you any different. It does, it counts. But your baby is not actually physically the one that's making you look like you have a baby bump just yet.
It's just your intestines.
Yeah, and literally, I'm not kidding. With my 4th, I looked like I was like 6 months pregnant, and I was like 15 weeks. And I was like, you know what? Screw it. I'm gonna rock the bump. Like, it is what it is.
And also, interesting fact, it takes between 5 to 7 years for your body to go back to normal after having a baby. So people that have babies back to back, that's why you feel like you get bigger and bigger, because you're kind of like your uterus is like a balloon that hasn't fully deflated yet. So you're just it's kind of like blowing out a balloon, and before it's all the way, you're blowing it back up again, and then blowing it back up again. Like,
well, and also it does, like, I don't know if you've ever done that with a balloon, but it never like fully goes back to like how it looked before. So I'm sure that's the same with like your uterus. I mean, obviously it's not a balloon, but kind of samesies.
Stretch marks and all. Number 2, my doctor said there was sugar in my urine. Am I diabetic? Okay, step away from Google.
Put the phone down.
During pregnancy, your kindergarten.
Okay, we're really tired. This is number 3, okay?
This is number 2.
Number 3.
It's number 2.
Number 3rd episode.
Oh. Number 3rd.
We've done too many of these. Okay. We'll get serious. No, we won't.
During pregnancy, your kidneys are fiddling. Oh my God. They're fiddling with extra blood. Okay. During pregnancy, your kidneys are filtering extra blood, and sometimes they get sloppy. Sugar can spill into the bloodstream, but your blood sugar is totally normal. That's why they do the glucose later on, just to kind of make sure. If your doctor didn't explain it to you,
it's probably not that big of a deal.
Yeah, probably not that big of a deal. One abnormal urine test does not equal diabetes. It just equals, hey, let's just watch it.
Numero 3. I left the house without my phone, forgot my appointment, and can't focus. Am I losing my mind? Yes. No, you're not. No, you're not losing your mind, okay? All right.
Have you seen this episode so far?
Yeah, we're like clearly losing our minds. No, you have pregnancy brain, aka limited brain bandwidth, okay? Your brain is currently growing organs, managing hormones, regulating emotions, and keeping you alive. Okay, so remembering where your keys are is an optional failure, okay?
Alicia!
This is why I hate freaking scripts.
Somebody wasn't sick all week.
I know, I've been suffering. I can't be mad at you because it is kind of my fault, okay? So remembering your keys is optional, okay? That's what your brain thinks. You're not stupid. You're not broken. Your brain is just prioritizing survival over keys
and everything else. Question number 4. Why do I keep getting random aches and pains in my lower sides and belly? Round ligament pain. I know. You're probably, you're looking for a different answer, but it's ligament pain. It's going to happen. Your uterus is growing. The ligaments are holding and stretching like a rubber band that you are not prepared. They was not prepared for this assignment.
No.
You feel it more when you stand up, roll over, sneeze, and just exist with confidence.
Yeah. feeling good. No, you're not.
Mhm. It can feel sharp, pulling, or achy, uncomfortable. It's common. You know your body, okay? You know what you can go off of the signs when somebody tells you that it feels normal, and then to you, what doesn't feel normal. So, any concerns you ever have, always ask your doctor. Let them explain it to you. And if you describe it to them and they say it's normal, then you can go off of that. But if they're like, let's do a little bit extra testing or something, then do that. So any concerns you have, always ask your doctor. That's just going to be the bottom line for everything.
Oh my God, this is me. Number 5, I found a lump in my breast. Should I panic? Let's slow the spiral. First of all, I'm right there with you. I have had a fatty lump in my breast for the last 2 pregnancies. I've had it checked out multiple times. I've been told it's fine, but I still am like, but pregnancy turns your breast into overactive hormone factories. Lumps can be swollen milk ducts, hormonal tissue changes, and benign growths. Currently, mine is a benign growth. It's not anything serious. In fact, it doesn't even show up like on an ultrasound, but I am at the age where I think I'll probably schedule a mammogram just to be safe. So it's not about fear, it's about reassurance. Tell the doctor, do not consult TikTok comment sections. Seriously, don't be like me. Don't go to Google. So I wouldn't be worried about it. I would just talk to your doctor about it, get it checked out. If you feel like you need a second opinion, get a second opinion. There's literally nothing wrong with that.
Number 6, my midwife said to make a birth plan, but didn't explain how. First, get a different midwife. Because if they're telling you to do something, it is their job to explain it to you. So, a birth plan, it's not a contract, it's not something set in stone. I can guarantee you, whatever birth plan you make, 9 times out of 10, it probably will not go that way, and sometimes it will. But not saying that it won't go your way. There's a lot of pregnancies where it does go your way. You just
be prepared for
yeah,
anything.
just when you make a birth, basically what a birth plan is saying is it's saying what you want to happen. It could be something as simple as I want my baby to be alive, because guess what? My 4th pregnancy, that was my birth plan. They asked me what I wanted, and I said I wanted my baby to be breathing and come out alive. That is what I said. For my 2nd pregnancy, my birth plan was to know that I was in labor.
And pregnant.
And pregnant. It's sometimes it can be as ridiculous as mine, or sometimes you can be very strategic, because I think you said you had a list of things that you wanted. You know, you can say on there that I don't want
Yeah.
epidural, I don't want this, I don't want that.
Yeah, I went to a birth center when I had my my first daughter. It was a birth center inside of a hospital, but it was a birth center nonetheless. And so I had to take birthing classes. That was a requirement. Not only that, but I did have to make a birth plan and like turn it in before a certain point. And so I did I made a birth plan. I actually just went to like Mama Natural, I think it was. And they have like birth plans that you can literally just like click what you want, and it just will help you make a birth plan
Yeah,
and print it out. That's what I did.
what it is basically they just want it there to just try to help you, because
Not only that, but a lot of the things that you're going to put on your birth plan, they already do nowadays. So like for example, when I had Jocelyn, sorry, I didn't mean to interrupt you. When I had my first, they like doing skin to skin immediately was kind of like optional. They used to like take the baby and like get them breathing and do their APGAR or whatever. But nowadays they don't do that. They literally, you have the baby, you have the golden hour where the baby is on you. That's what like most people put on their birth plan. People want to have delayed cord clamping. They still do that. Now also like if you want really delayed cord clamping, which is like where you leave it for like a half an hour, you do have to push for that. But so I would still put that on your birth plan. If you're not vaccinating your baby with some things, like I don't vaccinate with the Hep B immediately after birth. The only thing I will do is the vitamin K. I typically don't do the antibiotics and I don't do the Hep B. So I have that in my birth plan. But honestly, my last 3 babies, I didn't have a birth plan and everything went just fine. So
you don't do the antibiotics for the strep B.
no, I do. If I have no, the I ointment,
Oh,
yeah.
gotcha.
I was like, "What are you talking about?" And I was
I
like,
thought you were
"Yes."
talking about strep B, because I'm thinking of like the antibiotics,
Yeah.
they hang.
Yeah. Well, I have my babies too quick. Typically, I've been lucky for like the last 2 before this 3rd one that I was actually negative. My first 2 I was positive, and I was lucky to get the antibiotics in quickly, but I'm allergic to all the fast antibiotics. And so that was pretty stressful going into labor because I also have fast labors. So, like I think one of them to get like 1 full dose is like 8 hours. Luckily this last time they were able to find something and I was able to get a full dose in plus some before I actually had her, so we were lucky with that. And, yeah, I would say just make a birth plan, but don't stick to it too much. Like, as far as, like, okay, no epidural. If you don't want an epidural, the biggest thing I would tell you, the biggest piece of advice I would give is make sure nobody ever mentions it to you. Don't offer it to me. Just make sure, because even if you have a birth plan, a lot of the time they're not gonna read it. So, I'm just gonna be honest, they're not. And so, it's better to say something like, "My name is whatever, I'm gonna be your nurse." "Okay, hi, hello. I don't want you to mention an epidural to me. I don't even want you to offer pain medication. I wanna be the one to tell you, or my husband. We have a code word, and when I give it to him, he will tell you." Anyways, yeah, a birth plan is great to know in words what you want, but realistically, it's not likely that they're really gonna pay attention to it much other than, like, you reiterating it. So this comes back to the whole
Advocating.
Yes, this comes back to advocating for yourself. It's really important that your partner knows your preferences and make sure to keep those in the back of their mind, because a lot of the time when you're in labor, you're at, like, the most vulnerable you will be, and it's really hard to stand up for yourself when you're
Yeah.
in those
And
moments.
there's just a lot that changes, and it changes really fast when
Yeah,
it does start going. So I mean, I will say with my second pregnancy, I thought that I could do it naturally, and I had all the plans to,
you did it the
because you
first
because you
time.
did it before, you know.
Yeah.
But I will say that when I hit 5 centimeters dilated, my contractions stack on top of each
Yeah,
other.
they do.
And the problem with me is when I'm in pain, I hold my breath, and
Me
so I
too.
knew that with me holding my breath, that was causing distress to the baby, and so
Not only
that's how
that,
I
but it
knew.
hurts you
Yeah,
too.
and
It
so
makes your contractions
the
hurt worse.
epidural just got me to calm down. It
Yeah.
got me to calm down enough. So, I
There's
mean,
nothing wrong with
yeah,
that.
and you don't have to do epidural. You can do Stadol, you can do, I can't remember the other one, but
Laughing gas?
no, there's Stadol and Demerol, maybe?
I don't
I don't
know.
know.
She knows the technical
But
words,
then
we don't.
well, those go in your IV. It's just like to take
Yeah.
off the edge. Now they give you fentanyl, the good kind, not the one off the streets. And then,
Personally, if there's an option to, if you really wanna do an unmedicated birth, if you're gonna do it like that, I would try the, gas and air before you get the epidural.
Nitrous oxide. Yeah, so but I will say they offered that to me, but the only reason is because you have to breathe when you're in pain, so I knew that I
Oh, yeah,
wasn't,
I
and so
practiced breathing.
so you have to breathe.
With my first, I don't know if it woulda helped, but I did it with my third, and I'm telling you, it was the coolest experience of my life because, like, it took the give a heck away. Like,
Mhm,
seriously, like, I just didn't care about the pain anymore,
mhm.
and it was the coolest labor because it was like, you read about these women who, or if you've taken a pregnancy class, like, you hear about these women who have a really great birth and they look back on it and they're like, "I did that." Like, they feel empowered. They're like, "I did that." Like, that's how it was. I was like, I did everything by the books.
Mhm,
And, like, that doesn't mean it didn't suck,
mhm.
because it freaking sucked.
Yeah.
But it means that, like, I didn't panic. I stayed calm. Like, I breathed through it. I just listened to my body. It was the coolest experience of my life. Like, I even remember the ring of fire. And if you've had a baby unmedicated, you know, and sometimes even with an epidural,
Mhm,
you've experienced a ring of fire. And it's an experience. And I remember thinking, oh, okay. We're at the ring of fire. That means I'm almost done. Thank God. Because after that baby comes out, the pain does get better.
mhm.
Now, I will say with that baby in particular, she's still spicy to this day. Like, I was in pain afterwards. I think I didn't tear, but I had a lot of abrasions, I believe is what it was called.
Mhm.
And it's just kind of like where you have, like, essentially a ton of paper cut.
Well, I mean, I know this question's going a little bit long, but I will say that I do feel in my heart that it depends on the kind of labor you have. In my case, I had a traumatic birth, a good birth, a traumatic birth, and a good birth. And I think that when you have a traumatic birth and then you have a good birth, it does affect you and it does make you stressed out. So if
Did you
you,
have a traumatic birth or a traumatic labor? Because I had a traumatic birth with that particular baby
well,
as well.
Jaden was a traumatic
Right.
experience, and then, well,
Right.
and Liam,
Was your
because
actual labor with him also?
No, it was the birth because he
Oh, okay.
wasn't breathing. He ended up in the NICU, and that was why when I had the birth plan with Rosie, I said I just needed her to be breathing. And so I do think that when you have, not saying that a traumatic birth is going to make it harder to focus, but in my case, I was so stressed out on the outcome that I could not get myself to calm down. And sometimes medication does help you calm down.
Absolutely.
And
Well,
so,
that's what I'm saying. Even
yeah,
the
so
nitrous air, that's not
yeah.
technically fully
Yeah.
unmedicated.
So I'm just saying, like, some people are very lucky to have really good births to where they can keep that state of mind. I think that my second birth was not traumatic, but I did have a lot of fears to where
Right.
I couldn't calm down.
Yeah.
And then the thing was that with my second birth, it was so great that I was like, I could do this 100 times. And when I got pregnant with my third son, I went into labor and I was like, I'm great. I'm great. And then things went downhill and I was like, I couldn't focus. And then with my daughter, I was just a complete wreck because in my head, she was not going to come out breathing. I could not think, I could not even envision being able to hold her. Like I thought they were going to take her away and I was never going to see her. And so that I do think that your experiences do alter
Definitely.
it.
I completely
Yeah,
agree with
just,
that.
so I mean, I I will just say, like, just know everything's going to change. Like
Everything.
nothing goes by the book, but
Yeah.
we end up doing it over and over and over again.
Mhm.
I will say I've talked to a lot of moms where they've had a traumatic birth where they always opt in for a C-section because they need to know what's going to happen. They want to know what they've been through a C-section. They know what the outcome's going to be. They like knowing when they're
Mhm.
going in. And so it's
That is
just,
nice.
so there's just a lot of people like I think your first birth is just going to always be different than how you plan it after.
Number 7, why do I need the DTaP if I got it as a kid? Because your immunity fades. Just like your patients, the DTaP vaccine during pregnancy helps protect your baby from whooping cough in the first months of life before they can get vaccinated for themselves. When you get it in pregnancy, your body makes antibodies and passes it to the baby like a protective starter pack. It's not about you needing it again, it's about your baby needing protection early. I personally don't do this. This is a personal preference, but you can choose what's best for you and your family and do your own research.
And ask your doctor. And if your doctor's like, if they're pushing for something and you feel uncomfortable with it, get another doctor. If your doctor's pushing something and you want more information, there's tons of people you can talk to. You can ask your doctor's questions. That is why your doctor is there. Use it.
Mhm.
Use your doctor is just think of your doctor and your OB as another tool in your toolbox. Use it, take the advice, don't take the advice. In the end, you're the one that's going to always make the decisions
Yeah.
for your kid.
You and your kid.
Yes.
It's very important to remember to take care of yourself as well.
Yes. Number 8. My OB said that my baby was in an oblique position.
I'm so glad she has this one. Because I was like, I don't even know how to say that.
Yeah, wait till the next question. This person put it in our jar at work at the studio.
What's wrong with it?
Did you read it?
Yeah. Cryptic.
Yeah, I know. I wasn't expecting it. Is what I'm trying to say.
I'm sorry.
I was like,
Mm.
Okay. My OB said my baby is in an oblique position. What does this even mean? It means your baby is just laying like this. Go away. Just lounging, laying. I'm not laying sideways, but not head down, just kind of floating. Like,
I didn't know that one.
Yeah, babies just they flip constantly. They're gonna position themselves. They're gonna reposition themselves no
Can't they
matter what.
like flip even at like 38 weeks?
They can.
It's not likely.
You hope that they
Yeah.
don't because you hope they run out of room. But I have known a client where her baby flipped at 39 weeks and she had to have a C-section.
Yeah.
So I mean, babies are gonna do what they want to do.
Yeah.
Unfortunately, there's just nothing you can do about it.
Mm.
So right now, your baby's gonna flip constantly during pregnancy. Position doesn't matter until probably like 36, 37 weeks. Right
That's
now,
when it
they're
really matters.
yeah.
But like if you're 35 weeks, I'd say like try to do the flipping babies because they usually get comfortable at that point.
Yes, I do agree with that. I will say from experience, not personal experience, but experience what I've seen with others. If your baby is in a brief position and you are trying to flip them, before you do anything, talk to your doctor so that they are aware. Because there has been a few people I've known that have turned their babies, and when their babies flipped because they were so big, it broke mom's water. So I think that's why they say not to do it until like 35, 36 weeks because if it water breaks, and I think they're fine. But
I did all those things to try to
I
get
mean,
that
I did
baby
too.
out.
But I mean, I'm just when they told me that their water broke, I was like, well, I wonder if that meant your water was going to break anyway.
Yeah,
You know,
it's hard to say. Yeah, my sister-in-law's her water broke really early. So
I mean, There's some people that do things during pregnancy that I will never do. Like, you will never see me advocate for castor oil. Sorry. Never gonna do it. Not when there's too many warnings, and I know she's gonna say she did it, but no, you're not gonna see me.
I plead the fifth. Okay, number 9. I saw a show about cryptic pregnancy. Is it real? I found out at 5 weeks. First of all, yes, cryptic pregnancy is very real, and no, it is not common, and TV absolutely exaggerates it for shock value. A cryptic pregnancy is when someone doesn't realize they're pregnant until very late, and sometimes even during labor. This can happen when periods continue or are irregular, symptoms are mild or mistaken, body type or uterine position hides growth. I know somebody personally who's like this. The person was told pregnancy wasn't likely. It is rare. Most people find out between 4 and 7 weeks. Finding out at 5 weeks is normal and early. I always found out at like 3 weeks. I'm not kidding. Like the second you could have like your test turn positive, that was me. So, cryptic pregnancy does not mean you missed something. It does not mean you harmed your baby. And it does not mean your body is hiding secrets from you. It just means TV producers love chaos and fear cells. If you're testing positive, having symptoms, and seeing a provider, you are not in a cryptic pregnancy territory. You're just pregnant and online.
Well, since we're on that one, let's address the little elephant in the room.
Mm-hmm.
The big elephant. I was a cryptic pregnancy.
She had one.
I had my first was a cryptic pregnancy. I had him at 17 years old. I delivered in my bathroom. No, I did not know about him. Yes, I had a menstrual cycle every month. I did not show. No, I did not feel him. No, I did not hide it. I did not do anything. Have I ever seen one of these shows? Somebody sent me a clip from one and I could not watch it because it hit too close to home. I will say just because you can't believe it doesn't mean it doesn't happen, because I can tell you alone this year, I have met 5 different moms that have had a cryptic pregnancy almost like mine, except they made it to the hospital. I did not make it to the hospital.
Yeah.
So,
It's okay.
number 10, can you explain a cervical check like I'm exhausted? Okay. So, they're going to open up your legs.
Yeah.
And they're going to shove their fist
They're
in
going
there.
to say, scoot your butt down until
Make a butterfly.
until your booty feels like it's falling off of the table.
And then they're going to say, make a butterfly.
Or point your toes
They're
together.
going to make a butterfly and then relax. They're going to tell you to make a butterfly. Then they're going to say, scoot your butt all the way down.
Yeah.
Then they're going to say, flop your legs over.
All right, show us.
And then they're going to say, relax. And then you're going to relax, and they're going to stick their hand in there, and they're going to be like, relax. You'll be like, I'm trying.
They're trying to feel your throat.
And then they're going to go, is it uncomfortable? Yes. Do the fingers determine the dilation? Yes. Because if you have a nurse that comes in with a scrawny freaking fingers,
yeah, she's going to tell you.
She'll be like, oh, you're only dilated. But if you have a doctor that comes in there and he'll be like, oh, you're like a doctor's inch to a nurse's inch seems to be 2 different things. I remember my doctor was like, oh, you're 3 centimeters dilated. And then she would come in, oh, no, you're 2. I'm like, fuck you, go get him. Like, I'm not listening. I'm not going back.
Yeah. Don't tell me I'm regressed.
Yeah, don't tell me that I just regressed. I'm not clenching my butt. Like,
I know.
no, we're
I freaking
done.
Can't stand that crap. And also, I do feel like pain has a lot to do with effacement, which is like, not effacement, position of your cervix.
Well, effacement and dilation going.
Yeah, I noticed that if I was more effaced, like if I was over 80% effaced, it wasn't painful. But if I was like 50% or less, it was super painful.
Also, if you tense up, and I wish I could see. I don't know. I think after the first time, I don't know. I think people tense up, but it's just not a pleasant feeling.
No.
But I will say,
it's not fun.
It's not fun, but I will say the farther along you get, you kind of look forward to it because you want to see where you're at.
You're so like curious.
You'll kind of bite that bullet and be like,
I do also want you to know. I'm sorry. I do want you to know it is optional. You can tell your doctor you don't want to do it. You can definitely decide not to do it. Same thing with like a stretch and sweep. You don't have to do that.
Mm-hmm.
So just I want to throw that out there.
Yeah, because your consent still apples.
What?
Your consent still applies.
You said it so confidently. That was so confident.
I gotta
Okay,
order some
so a
glasses.
cervical check is when your provider checks the dilation, the effacement, which is how thin it is, how open your cervix is, and the station, how low your baby is. Also, that does affect it too, because if like you're super high, it does feel like they're trying to peel your throat.
And also, it is completely common that you spot after, because they're irritating your cervix and they're reaching in there. So if you ever go for like your 35, 36, you go to labor and delivery and they check your cervix and then you go home and you wipe and you are bleeding or you have it in your underwear, it's completely normal. As long as you don't have like clotting and cramping, I would not worry about it. It's kind of like, it's going to be like kind of the same, spotting you get whenever you get a pap smear done.
So,
If tonight's question sounded exactly like your 2 a.m. monologue, you're not alone. You're not dramatic. You're not broken. I feel like we say this every outro, but everybody feels this way. Your body is just doing something huge in a very loud way.
yeah.
Take a breath, drink some water, eat an apple.
Stop Googling.
We'll keep waddling through the chaos together.